Welcome to Jersey Rules, where we break down the laws shaping everyday life in the Garden State. Today, we're diving into Assembly Bill A-1502, or the Patient and Provider Protection Act, legislation advancing in Trenton that would tighten oversight of pharmacy benefit managers, often called PBMs. These middlemen play a major role in how prescription drugs are priced and assessed. Bill A-1502 introduces new requirements to hold PBMs accountable, to create a fair process for independent pharmacies and make it easier for patients to find the most affordable option for their medication. So what does that mean for you? To break it down, we spoke with the bill's sponsor, Assemblyman Roy Fryman of Legislative District 16, to find out more about how this bill is taking shape and how it could make prescription drugs more affordable for every New Jerseyan. Assemblyman, thank you so much for being here today. We know healthcare costs are high and people struggle to afford prescriptions. You're working on legislation to tackle these issues. But take me to the beginning. How did this issue catch your attention?
Pharmacies and pharmaceutical medications are a growing portion of the overall healthcare costs. 20%, I think, out of every dollar, 20 cents out of every dollar is spent on prescription drugs. And what we're seeing is this continues to grow. It continues to become more and more of a challenge. And there's a frustration from the individuals, the patients, as well as the doctors, of every time you try to get medication, you go to the pharmacy and there's this angst. There's this problem of, well, I'm sorry, that prescription, your insurance is not going to cover that, or you have to get prior approval, or it's not, you have to pay a lot more money for that. And so this noise and this pushback keeps on growing. And so it required a lot more investigations to why is this happening? And that led to these groups, this middlemen called the Pharmacy Benefit Managers, or PBMs, and that's what we started to investigate.
Can you explain what a PBM is?
Sure. Well, it goes back probably a couple of decades ago when an employer was building out their health insurance and they wanted to provide to the employees. And at the time, some basic plans didn't cover prescriptions, and then it became more and more popular to make sure that prescription drugs were included in your health insurance. And it's not so simple as to, well, how do you add medications and which ones do you add? And especially when you have a number of medications that do similar things. So these pharmacy benefit managers became advisors, administrators, to help the employers and to get added onto a health insurance plan to help them navigate this. They were the professionals. And they came and said, look, we will do a couple of things. We'll help administer the prescription side of your insurance, and we will negotiate with those big bad pharmaceutical companies to make sure that you're getting the best price and the lowest possible price. And tell you what, we will get paid by sharing in the savings of what we knock down on their price. So we'll beat them up for you, the pharmaceutical companies. Will share in the savings together. And that's how they started. And they were actually quite effective and very, very good at what they did. And you didn't hear about them. And no one knew they existed. And they grew and grew and grew in terms of their importance and prevalence. And that then became the problem. They grew, and right now you have 3 companies where 80% of all the prescriptions we use in the United States somehow manage to flow through these 3 companies. And that wasn't good enough for these three companies. They then decided that, we need to expand into different areas. So then if you now know, there are times where you're saying, well, tell you what, you can go to your local pharmacy to get your drugs, but if you want, you can get it via mail order, and might cost you less, but that mail order is actually the PBMs. So they're no longer acting as an advisor. They're no longer acting as just a negotiator. They're actually acting as a distributor of medications. And they're controlling how medications get to patients. So it has gone far from where it was in its infancy to where it is today.
So how is this actually impacting people day to day?
It's making it more difficult for your providers, meaning our doctors, to deal with this paperwork, the administration. It's incredibly frustrating to us, the consumer, the patients, of that medication is not covered. And it's also impacting the pharmacist and the pharmacies, of particularly the independent ones, where you have much more of a personal relationship, because they are now finding themselves competing with what they used to be, these middlemen that no one ever heard of. But these middlemen are now in the business of dispensing medication, which is really what pharmacists do. And they own pharmacies, they own these wholesale and these mail order distribution. And they are actually making it more and more difficult for these independent pharmacies to exist. And so and what's worse is we don't think that they're actually driving costs down any longer. And that's when it's really troubling. That if the overall goal is saying, look, we want to keep costs as low as possible, but they make a living sharing in theoretically the savings, the math doesn't work. And what I mean by that is, hypothetically, if the pharmaceutical company's saying, we're going to cut our price in half, the overall pricing, the PBMs actually will lose money, because their percentage, if they get a percentage of the overall cost, their percentage just went down. So the way in which they're getting paid isn't designed, there's a conflict of interest to helping to drive down the overall cost of prescription drugs.
Can you walk us through what your bill, A1502, the Patient and Provider Protection Act, actually does?
It does three things. It sets up the payment and the relationship between the PBM and the client. Mentioned before, originally they started out they're going to get a percentage of the savings. Think of it as a commission. It addresses that concern. It's called delinking, where it says, your relationship should not be tied to, the PBM's relationship should not be tied to the cost of the medication. It should be indifferent. You should be focusing in on giving advice, administering it, but if they have a vested interest of inherently that overall cost of the medication going up, that's in conflict of what we really want, of the costs to be coming down. So it delinks how they get paid. So that's item one. Item two is, because they are in the distribution of medication business, they wholesale, they are the ones that, for the most part, the only place you have to go through them to get specialty medications. It says that how in which they pay and reimburse the local pharmacies has got to be at a bare bones minimum. They cannot go out of the way to drive them out of business. They can't, and right now we're finding that they are paying themselves, their own preferred pharmacies, at a higher rate, and they're paying independent pharmacies a rate for the medications below what the independent pharmacies buy it at. they are putting them out of business. And it establishes a minimum amount, which is based upon a Medicaid amount nationally, the lowest possible amount. And the third one has to deal with a fiduciary responsibility. It says that the advice that they give to their clients, to the employers, has got to be in the client's best interest. If they are hired as experts, if they're hired as advisors, that advice has got to be in their client's interest. It shouldn't be saying, I'm going to give you really good advice, but in the back of my mind, I'm also thinking about my own bottom line. This is the kind of thing you would expect when you have any professional advisor you come in, whether it be an attorney, an accountant, or anybody you hire. You expect them to saying, look, I'm going to give you advice. Yeah, but if you hired an attorney and said, but the advice I'm giving you is really going to prolong my billable hours, that's horrible. You would expect the advice is in the client's best interest. And so we're saying the fiduciary standard saying you always put your client's interest first. And so it's those three elements that are in this bill.
I know this legislation is something that you've been working on for a while. What would success look like to you?
So we've had a lot of success. Keep in mind, we're dealing with companies that are some of the largest, most significant and profitable companies in the United States. I don't expect them to say, oh, Assemblyman Fryman, you have this bill. We give up. You caught us. They're not going to do that. It's unrealistic. They're going to fight like hell. Because this threatens a little bit of what they do. So I suspect that this is going to be an incremental change. I also expect that this is going to be whack-a-mole because they're going to be pivoting and doing something else. And they're going to adjust because they're large, capable organizations. And so they'll find an alternate way, and we're going to have to adjust. So this legislation isn't going to say once we pass it, it's done and we've solved the world's problems. So this is, I think, a very important step going forward, but I wouldn't expect rainbows to magically appear over the State House because of this. But it's important.
Democrats like yourself have been really targeting making New Jersey more affordable. How does this fit into the mix?
Healthcare affordability keeps on coming up as one of the highest priorities. And this is not a partisan issue, it's just on individuals' minds. And I would also suggest this is not a New Jersey issue, this is across the country. The rising cost of healthcare and access to it is, whether you're an employer, an individual, we haven't solved this challenge. And I will tell you, mathematically, it's not hard to solve healthcare costs. You can just take away access, you can just take away quality, but that's not what we're trying to do. The goal is how do you reduce the cost without reducing quality, without reducing access. And in the past, what we've done policy-wise and from an employer standpoint is we've moved furniture around. We've shifted the plans. We've said, all right, as an employee, you're going to pick up more on your copay or higher deductibles, or these medications aren't going to be covered. So various different. We haven't taken. The only real way to do this is to take cost out. Well, to take costs out means that somebody's going to make less money. And so right now you have a situation where everybody involved in delivering healthcare agrees it's too complex. They would never build it like this if we were starting all over again. And they all agree it's not their fault, it's the other person's fault. So if we're really going to make a change, it means somebody's going to have a disruption. Somebody in their business model is going to be impacted. And that's where it gets ugly. So we're going to have to break some eggs along the way, realistically, to have an authentic change. Otherwise, we're just moving furniture around.
Assemblyman, is your bill going to lower healthcare costs for New Jerseyans?
I believe it will. I believe we are going to see it have a positive impact, but unto itself, it's not going to be the solve. So I don't want to overstate its impact, because I think this is going to be a step. I think there are other significant issues. This is not, looking at the PBM and saying the problem, it would be wrong and I think unfair to say that the problem with healthcare in New Jersey is the PBMs. I think it's a contributing factor. And I think it's so complex. We have to do a lot of steps along the way if we are really going to work at this. And I don't think we're ever going to be done. I think it's going to be a continual challenge of always working at, well, where else can we continue to lower the costs without impacting quality, without impacting access.
Thank you so much for taking the time to speak with us today about A1502, the Patient and Provider Protection Act.
Well, thank you for being here.
You've been listening to Jersey Rules, a production of the Assembly Majority Office. If you've enjoyed this episode, make sure to subscribe and leave a review wherever you listen to your podcasts. You can find us on Apple Podcasts, Spotify, and YouTube. Thank you for listening.